All right, for the sacroiliac joint stress test, can you flip over for me? We've got anterior and posterior gapping. Now, these do stress the ligaments, but one of the things we have to understand is that the interosseous ligament in particular, but also the posterior ligaments, are two of the strongest ligaments in the body. These don't get torn traumatically. The bone will fracture before these do. They can get stretched out though. The anterior ligament is weaker and it can get torn. But for the most part, when these tests reproduce pain, it indicates that there is an arthritis present in the SI joint. Okay, so for the anterior gapping test, I put one hand on the ASIS on my side and the other on the other side of the patient. Now, if I cross my hands, I don't have to worry about forcing them laterally. All I need to do is just drop my body weight straight down between my hands and they'll spread, like so. Now, there shouldn't be much in the way of movement. This is a very stable articulation. So I hold this until I get a nice hard capsular end fill and or reproduce symptoms. The posterior gapping test, if we lay you on that side for me, consists of pushing the innominate forwards, and this will gap the back of the joint. So the way I do it is drop my forearm onto the soft spot in the pelvis between the iliac crest and the trochanter, and simply put my body weight down through that using the fleshy side of my arm so it's as little uncomfortable as possible, and hold that until I get an end fill or reproduce symptoms. This test, as I say, is really for an arthritis. And your problem now is it a systemic arthritis or is it a traumatic? Now, if it's a macrotraumatic arthritis, they will have a history of trauma. However, a microtraumatic arthritis won't have that history. And the secondary stability test for the pelvic, for the SI joint, where you're actually looking to see whether the joint is stable, is designed to determine whether or not you have a hypermobility instability or whether you actually have a systemic arthritis. And those secondary stability tests are found on volume 5D.